blood-brain barrier, it prevents the circulating blood substances, bacteria, and drugs. We know that the blood, okay, blood vessels which are in relation to neurology structure are some of the neuron structures. Is that clear? So there must be any drugs, there must be any toxins that are going inside the blood, and that toxin may go in our brain, which is very sensitive areas. So the nature has created a system that we must inhibit or prevent these of the bacteria and the toxins to go inside a specific brain structure. So that's the reason, to prevent these bacteria and toxins, the nature has created a blood-brain barrier, which is contained by the 4 points, are the four most important structure that are making blood-brain barrier. These are the number one are the tight junctions between the non-fenestrated capillary endothelium. Okay, there is a fenestrated capillary and non-fenestrated capillary. We will study in vascular section, but the capillary, when there is like this and this one, when there is a connect between them, there is a site, there is a connect, there is no connection. This is called actually fenestrated. When there is usually attached with one another, this is non-fenestrated. Is that clear? So there is a non-fenestrated capillary endothelial cell, and they are attached with a tight junctions. Very important. Next, the blood-brain barrier is made by the basement membrane. You see that this is basement membrane. Next structure. Third is pericytes. These are cells surrounding this area. These are the pericytes. Next, very important is the astrocyte foot process. You see that this is astrocyte. This is the astrocytes, and these astrocyte foot process are the four structure that making the blood-brain barrier. Is that next? The question is like this: if patient who has been any hypoglycemia, he sudden taken dextrose, and dextrose creates the glucose, and that glucose go to like patient regain the consciousness after giving some glucose. So which of the following is a pathway that this improves the symptoms? So they gave you like that symptom, the patient was in hypoglycemia and he has a sudden loss of consciousness, and when we give the IV dextrose and whatever the glucose, and then he regains consciousness. So what was the pathway, how that the symptoms improve, and why this glucose went to the brain? The brain captures this glucose by a specific method, which is carrier mediated transport mechanism. So remember, carrier mediated transport mechanism is a concept. Amino acids, which is a building block of proteins, are also carried by carrier mediated transport mechanisms. Is that clear? And the next is non-polar or lipid soluble, which are easily crossing the via the diffusion. Okay, the non-polar lipid soluble substances can cross rapidly via diffusion. Is that clear? Rapidly via diffusion. Very important. And next is circumventricular organ. What are the different organs? What are different structure? This is very important question also, that are not containing blood-brain barrier. So my next question is, what are structures that are not containing blood-brain barrier and very sensitive to chemicals, very sensitive to bacteria, very sensitive to the drugs? These are very important because they have no blood-brain barrier, and they allow the molecules to affect the brain area. And one of them, these are circumventricular organs, and they have a fenestrated capillaries. Fenestrated, we discussed that this blood-brain barrier is made by the non-fenestrated and circumventricular organs with fenestrated capillaries and no blood-brain barrier allow the molecules in the blood to affect the brain function. And one of them is area postrema, which is called vomiting center. Because vomiting center detect the chemicals, detect the change in the blood, and it is not obstructed or not prevented by the blood-brain barrier. It leads to the rapid change. And next is organum vasculosum lamina terminalis, which is called OVLT, organum vasculosum lamina terminalis, related to osmoreceptor. When you smell something, they directly go and act. There is no prevention of these senses in blood-brain barrier. Next is neurosecretory products, which directly enter into the circulation, like a neurophysin protein that carry the ADH. That ADH release is not being under influence of blood-brain barrier. So next is the neurohypophysis releasing the ADH is not influence of the blood-brain barrier. Okay, next are what are pathologies that can disrupt this blood-brain barrier? Next question is, what are the pathologies that can disrupt this blood-brain barrier? One of them is stroke, ischemia. Okay, stroke, ischemia. That is one of the most important concept, stroke. And this stroke leads to a vasogenic edema, and that vasogenic edema breaks blood-brain barrier. Next are when we give a mannitol. A patient presented with increased intracranial pressure due to any cause, or sometimes they presented with a history of the brain tumor, presented with increased intracranial pressure, and we give the mannitol, as the mannitol is a drug to give lower to decrease the intracranial pressure. So mannitol is the drug that decreases intracranial pressure, ICP. We give this drug, and this disrupts blood-brain barrier, and it increases permeability of the medications. It increases permeability of the medication. This is the reason why in clinical settings, when you are doing the house job, when you are a resident, sometimes you will be instructed by your senior that please first give the mannitol and then give the antibiotics and all the other drugs. Okay, so this is usually instructions given by the clinic, like senior or like clinical instructor. Why? The reason is that when mannitol disrupt blood brain barrier, so antibiotic can easily cross. So sometimes it is favorable that it's depend upon the situation, that if we want to we want to cross the blood-brain barrier, a specific antibiotics to have a rapid action. So usually we give mannitol and then we give the antibiotic. So there are some of the cases we prefer to break the blood-brain barrier, and sometimes there is of course like a problem when there is we give the mannitol and there are some of the medication we do not want to cross the blood-brain barrier, but it happens. So this will be as adverse effect. So it is the difference between the physiologically and difference. It may be differentiated. So what we need according to the case-to-case scenario. Is that clear? So we have discussed the blood-brain barrier and what are the normal components of the force structure and what are the pathologies related to blood-brain barrier. And now, any question till now from this section?